Hi, I'm Brian Mandell. I'm currently at the Cleveland Clinic, where I'm a professor and chairman of academic medicine in the Department of Rheumatic and Immunologic diseases. With the Merck Manual, I serve as the editor for the rheumatology section as well as allergy and immunology. So my entry into clinical medicine is actually a bit of an odd and convoluted tale. I grew up across the National Institutes of Health in Bethesda, Maryland, with no physicians or doctors or scientists anywhere in my family. And I was always intrigued with medical research. And I went to college and graduate school, had my PhD, all in basic science areas, and then thought as my interests led towards inflammation and study of inflammatory models, I thought I needed to know more human biology to get there. So that led the foray into medical school with no intent to ever actually practice medicine or even do a medicine residency or fellowship. But I was married, and my wife had far more common sense than I did about this and said, you're either doing that or I'm leaving. So I thought doing a residency and fellowship was a really good idea. And I trained in medicine and I trained in rheumatology, went back to running a basic science lab, and found that I'd actually grown to love clinical medicine. So it really pulled me astray and had to make the decision that I want to split my life between the two, basic science research and clinical medicine, or really devote to one or the other, and tried to answer a question which I would miss more, and decided I would miss actually clinical medicine more than basic science. Made that track switch into medical education, teaching, and practice, and after a couple years realized that it probably was the right decision to make. Well, about the field professionally is just the incredibly rapid advance of technologically directed therapies, which for years in rheumatology we didn't have. We had corticosteroids, which we didn't understand how they worked, and we had a bunch of nonsteroidal anti-inflammatory drugs, which we did understand, but they didn't work very well. So the most exciting part is really to bring advanced therapies specifically targeted to specific disease to specific patients. And that remains an excitement every day to make those matches. I would say the most rewarding part of work is really dealing with individual patients and the ones that actually can make specific diagnosis, or even without a specific diagnosis, make specific changes in their medical care that makes a difference in their life. And that really is incredibly personally rewarding, as well as the relationships you build with patients and their families in managing patients who have chronic diseases. Well, when I left medical school, I really didn't have any expectations of being a practitioner because I really viewed myself in a laboratory, popping into a clinic maybe a day a week at a university. So I had no preconceived notions of what it would be to be practicing medicine. I had the opportunity to really create for myself the image of how I was going to practice and what my relationship is with patients. That's grown as many physicians, as well as myself, have morphed their practice environment into large, more corporate environments. I'm still in what I would say is a major academic medical center, but it's also become major corporation. So that part is certainly different than I would have ever envisioned, even if I had planned on practicing medicine. Oh, preventing burnout is a challenge, and I'm not sure that any of us are immune from the possibility of that happening. My advice to people is go with your passion. If there's something that you really find troublesome or not enjoying, escape from that part of medicine or that part of your life or that specific situation as quickly as possible. Sometimes easier said than done, but I think try to take the parts of your professional life that you don't enjoy, or try to find a way to work around so they're not occupying the bulk of your time. And don't forget what you really love about what you're doing and try to magnify that. Spare time? I have no spare time. I think that's true. I really have no spare time. I have become a fan of the Cleveland Cavaliers. No relationship, of course, with LeBron James or the fact that they're winning still. I enjoy time with my family and time at the sushi bar and at the wine bar. But I do find that the calling of medicine is really all-encompassing. And as we've become electronically connected, it's harder and harder to leave that ever. So it really is spare time in your spare time that you try to carve out for yourself. I think the main difference in being in an academic medical center as opposed to in a true private practice, which for most physicians is now a group practice, is really the degree of collaboration and communication that can easily be obtained down the hall or across campus. I think as physicians increasingly are siloed into group practices, it's very difficult to stay up with the medical literature and what's happening around them, and specifically how their colleagues in other subspecialties feel about things. And I think that really is the major plus to me professionally. So the ability to acquire medical information in a current and timely way is so incredibly important to physicians in training, as well as patients. And it's so satisfying to be involved with a project like the Merck Manual that is pure information directed at the use of clinicians and patients. And I just think that's so important to have that accessible no matter where you are here, internationally, and socioeconomically, that you can access this.